I'll reassure the clerks there's honestly no wrong answer here. I'm actually very interested to hear your thoughts on what character intrigued you the most. Remember to unmute. Well, if the clerks have no opinion, I'll go to the other students that are joining us this morning. Any other students have any observations in terms of what was interesting to them in last night's episode?
The one that was really interesting to me, as I forgot his name, but the guy that was hosting the talk show.
Kramer.
Yeah. So I mean, how he just basically took on this like entire like different personality. I mean, I don't know his personality before, but he kind of just transformed into this like other persona that he, I guess, like, you know, revered, or like, you know, that he really wanted to be, and he just kept that character going, and so I thought that was really interesting, and he did a really good job of doing that, and roping other people into it. So that was pretty interesting for me.
So Kramer, upon finding an old set from the Merv Griffin show, brings it into his apartment and begins to develop the persona of the former talk show host. All right. Is the behavior clinically significant? Anyone?
I think it could be, because it's unclear if he knows he's taking on this role, or he kind of just, you know, merged into it in a sense.
Could you give me an example of how the behavior may have impaired some area in functioning of self or others?
It's unclear if he like has a job, or, you know, maybe he stopped going to his job to like make this nest and let this take over, so, or family members or anything like that.
So in terms of vocational functioning, it's a little tricky because if you've watched Seinfeld before, you know that Kramer, in fact, has had a job for most of the series, only to be disclosed later on. I don't know what exact season or episode, that he's been on strike for all the work after years of what appeared to have been unemployment, and then in that same episode quits his job. So what's ever going on guiding his behavior in the Merv Griffin show seems to be pre-established. And while it is true that he definitely has impaired vocational functioning, due to the fact that it predates season 9 and the episode we're discussing today, the Merv Griffin show, we really can't say that whatever's going on seems to be influenced by anything that we may have observed in this episode, if that makes sense, right? So it looks like, it really does look to be pre-established. And again, of course, the parallel here for the clinician, for the psychiatrist, is to always try to establish timeframes. We do a great job teaching. Siggy Caps dig fast with regard to the psychological or psychiatric assessment. It's taking those signs and symptoms, if diagnostic, identifying whether or not something is clinically significant, and making sure you establish timeframes with regard to symptoms and then the effect they have on self or others. And in this case, I'm not so sure that the fact that he is unemployed has much to do with what's going on in this particular episode. There's a couple of notable examples in the Merv Griffin show that I think does support the notion that there is some dysfunction. Number one, Jerry and his girlfriend are certainly in conflict. And of course, Jerry is playing a major role in that, but that conflict is precipitated by Kramer, by his bringing the girlfriend out from backstage. So Jerry's relationship has ended because of Kramer's actions and behavior pertaining to the Merv Griffin show. So that's an easy example. And then, of course, we see what happens to George. He actually sustains physical injury as a direct result of Kramer's behavior as well. So I think the easy answer to the question is that whatever you have identified as interesting behavior in Kramer is outside of a culturally sanctioned norm, aka is abnormal, and now we're at a point where I think the consensus would be that it's also clinically significant. The third step in formulating this behavior is now to see if there's a diagnostic label. Because if there is, aka the single best diagnosis, there's usually a treatment plan attached where we can address the behavior, improve it, if not resolve it. So from that point, the question really lies as to whether or not you believe the behavior is part of a mood anxiety cluster, or do you think it's better explained by a psychotic dissociative cluster? So what, I'm totally new to Zoom, so I have no idea if we can even do polling. But just for some feedback with regard to the audience, any thoughts, A or B? Is it a mood anxiety cluster or a psychotic might be going on here?
I was like, what?
So what do you mean? Expand on that. Anyone?
I think it's a dissociative psychotic kind of disorder.
And you know, when you're case formulating like this, and you're kind of going down this algorithm, you need to be reassured. The clinician needs to be reassured that there is no right answer. You're just choosing the way you want to approach this particular case. So don't be at all concerned about choosing A or B. If you are wrong, you will still end up in the right place. It's just a question of how you get there. And in this case, this morning, we're going to choose to get there through the psychotic dissociative cluster. So the next step would be, and we're going to go into this in far more detail when we have more time when we discuss Peter Pan, but the next step would be to begin to look at Kramer's character perhaps as being afflicted by a condition called schizophrenia, right? If you choose psychotic place to start and continue with our case formulation. Not that, I mean, because of time purposes, I need to jump around a little bit this morning. There are a couple of things that come up with regard to his quote-unquote psychotic-looking behavior that I think needs to be discussed this morning. Number one is, how would you actually look at what happens with regard to someone who takes on this persona, but let's say they're not Kramer's age, but instead they're 5 or 6 years of age, maybe even younger. As a parent, as an aunt, as an uncle, what would you think of if you actually saw this happen?
Where's the PCP thing?
Anyone?
I would think you could consider it to be normal behavior if they're in like the younger 5-year-old age. Maybe they're having like imaginary friends and things like that.
Exactly right. Again, I would expect you to think that the behavior you're observing is normal until proven otherwise. and for someone where it's age appropriate, the idea would be that this is largely developmentally certainly sanctioned, and therefore there's not much more to do in terms of a child having an imaginary friend or a child engaging in fantasy play. So this is actually the defense mechanism called fantasy, which is defined as an autistic retreat into some inner world that allows the individual, whether they're 5 or 35, to provide a buffer from the harsh realities of the external world. Again, children growing up need to grow more independent. That's a very significant transition from the dependency of infancy and early childhood through one's childhood, and again would be considered to be developmentally appropriate when in fact age appropriate. But for Kramer to continue this behavior in his mid-30s would be out of that context. So it would be abnormal, and as we just pointed out, perhaps even clinically significant. What is actually defined through maladaptive fantasy. Fantasy, again, being a defense mechanism. Anybody? So the single best answer on your shelf exam would be the schizoid personality disorder. Okay, individuals with this cluster A personality disorder as adults engage in maladaptive fantasies. It's an unconscious process that somehow resolves the conflict, again, an unconscious conflict, that results in their retreat, and they're isolating and operating within this fantasy world as if they were 4 or 5 or 6. Okay, so I think that's one place to start with Kramer, and then we can always discuss whether or not what we're seeing might progress to something more severe, perhaps within the context of a psychotic disorder, right? So fantasy. Now, what's interesting is that we see this paralleled in his best friend, Jerry, who also is engaging in fantasy play. He is literally behaving like a child in his girlfriend's apartment. And it's because certainly some loss of childhood. He has openly told his friends, specifically Kramer, that when he was little, he wasn't able to play with these types of toys. And certainly now as an adult, having had this chance, he is engaging in that fantasy play that we would have expected at the age of 5 if he were allowed to play with those same toys. But there's a second defense mechanism operating in Jerry, and that is the actual process as to why he's doing this as an adult, and going back to acting like a child, and that's called regression. So the combination of regression and fantasy as a defense explain not only Kramer's behavior, but certainly with the regression, Jerry's behavior as well. So the dynamic between these two characters, really the two main characters on this impromptu talk show, really get to the core of some defense mechanisms. Defense mechanisms in general, and what you need to know for your test, are unconscious processes of one component of your personality called the ego. Okay, so the ego has these processes that allow for the resolution of conflict. And that conflict, per Sigmund Freud, is always the friction between what one wants to do, and that's governed by the pleasure principle of the id, and what one is allowed to do, right? And that's actually governed by the reality principle of the superego. The id and the superego will never see eye to eye. They're both equal and opposite processes. And because of that, we are always at internal conflict. There's always an internal struggle about what we would like to do and what we are allowed to do. This conflict, Freud referred to as anxiety. So he thought that humans were anxious animals. And the reason why anyone's anxiety would be kept sub-threshold has everything to do with ego strength, and more specifically, the adaptability and the functionality of these processes of the ego, themselves unconscious, called the ego defense mechanisms. There are several. The two that I think are highlighted in last night's episode, The Merv Griffin Show, include regression and fantasy. Any other characters of interest, any other behavior that you observed last night that you thought was interesting?
I thought it was interesting that George was like so amenable to like taking the squirrel to the vet and like paying for the surgery and doing like everything that his girlfriend was asking for.
Okay, keeping it educational. Anybody have any thoughts as to why he's doing what he's doing?
It seemed to me a little bit maybe like some like borderline personality traits. He's very fearful maybe of losing her and losing his relationship with her, so doing everything he can to keep her.
Yeah, there could be that is a defining characteristic DSM criterion for the borderline personality disorder. That's right. Any other thoughts? Let's say, yeah.
Based on what you said, Alejandra, it sounds like it could also be like a mature defense mechanism. He's just being altruistic towards the squirrel in response to what he was experiencing.
Yeah, and I would suggest as a clinician, you kind of go down that route first, right? It's the benefit of the doubt, and looking into that. And if you're wrong, of course, you've got to be flexible as a clinician and change. Thinking that this may, in fact, be George's sense of abandonment or fear of abandonment. Now, again, for those of you who are familiar with the situational comedy Seinfeld, you know that there are 8 seasons that have built up to this particular episode. So you know that George's action. So this is taking a patient history. This is watching Seinfeld seasons 1 through 8. George, I will share with you this morning briefly, has a very, very maladaptive relationship with his parents. And a lot of his adult behavior appears to be unresolved issues from his childhood. So with that in mind, the sense of abandonment and the need to be liked, and that actually is an overriding subplot in one other episode where George demands or is absolutely incensed with this need to be liked, specifically in that episode by Jerry's girlfriend, who can't stand him, right? He's got this overwhelming sense of need to be liked. Any other thoughts about George? You're going to see George is a very interesting character because unlike really the other characters, and maybe Elaine would be included as well, but not quite as bold and straightforward as George. George arguably is the best character to create a didactic or a course around when it comes to psychology or psychiatry. His behavior is not only incredibly interesting, but it really does defy simple classification that is built into books like the DSM. You can't label him. So week in and week out, we're going to identify George's behavior, and week in and week out, we're not going to be able to simply say, and it's due to blank. We're going to be challenged, and as part of that challenge, we're going to be able to cover a lot of the DSM, not a single diagnosis of which really fits George perfectly, which is great for teaching purposes. So we'll keep an eye on this. For today, defense mechanisms, altruism, and perhaps, again, cheating a little bit, aka the patient history, seasons 1 through 8. This is due to abandonment issues stemming from early childhood experiences. So we're 20 minutes after the hour. We have a couple of minutes left here. Anybody else have any other thoughts or observations from our episode this morning discussing the Merv Griffin show?
Dr. Tobia, can you hear me okay?
Perfect. You're good.
Great. So kind of circling back to Kramer a little bit, I found it interesting the way that the episode was set up with him and his talk show. Because if we're thinking of like schizophrenia and those kind of psychoses, you kind of get this vibe that he's staring at the actual camera that they're shooting the episode at. So I kind of imagine him imagining like a fake kind of crowd and a laugh track in the back that he might be hallucinating about those various aspects of what could be that television show.
Yeah, and they do really bring you right to that line of psychosis and reality testing. There's no doubt about that. And that's a great teaching point to bring up, in that, again, we're so fixated on labeling people and making sure we get the single best diagnosis on an exam or even a certifying exam. But in reality, what often happens is that individuals, for instance, may be afflicted with a condition like the schizoid personality disorder, right? So this is an established personality disorder that is classified as cluster A in the DSM. The schizoid, again, is hallmarked by social isolation and maladaptive fantasy as that defense mechanism. it is known, there, again, this is in the clinical literature, this is in the medical literature, that individuals with this condition, as any cluster A personality disorder, are in fact predisposed to develop schizophrenia or a related psychotic disorder later in life. We know that, okay? And again, that's established in the medical literature. But, with regard to human behavior, sometimes it just doesn't work out quite that in a linear fashion like that. Instead, there's a phenomenon referred to as stress-induced psychosis, where individuals who are predisposed, perhaps due to the diagnosis of a cluster A personality disorder, when under increasing stress, can actually manifest psychotic symptoms, even though they don't have established schizophrenia per se, or even in that linear timeline, have not gotten to that point where they have met clinical criteria for the condition, in this case, schizophrenia. So it's a great point here where perhaps Kramer, let's say we're going to use a provisional diagnosis of schizoid personality. Now there's something stressful in his life, and he begins to look at the camera, believes somebody's behind the camera, hears audience laughing, rule out auditory hallucinations, and is experiencing a bout of psychosis, but still perhaps falling short of actually being diagnosed with a condition such as schizophrenia, or in this case, even schizoaffective disorder. So stress-induced psychosis, it does happen. And the question here would be, as a clinician, what might we identify as that increased stress, that precipitant that resulted in all this? I'm not sure if that information is actually contained in this episode or perhaps even in a prior episode that was building up to this. All right, so stress-induced psychosis. It's a good point. The only other thing, I know we're getting now to half past the hour, I did want to bring up to make sure I covered is Jerry's behavior. Okay, Jerry's behavior is incredibly concerning in terms of what he does. I mean, of all people, Kramer actually identifies it as such, not once, but twice. One time he goes off set, he tells them, "Not on my show, buddy," or "Not on my watch, buddy." And at the end, he actually brings in Jerry's girlfriend to make sure he discloses what Jerry is doing to her. So not once, but twice, of all people, Kramer is the one who appears reality-based when it comes to Jerry's behavior and identifying that as maladaptive. We described Jerry's behavior with regard to defense mechanisms, regression, and fantasy, but now I want to flip this to a little bit of psychopharm. What we're seeing with regard to Jerry providing his girlfriend both turkey, and it's clearly identified in the script as containing tryptophan, and even wine, but certainly turkey, is, I think, introducing the concept of the catecholamine hypothesis for antidepressants. Okay, so tryptophan is the precursor to serotonin. And of course, once we begin talking about serotonin, we're looking at that indolamine, right? That bioactive amine that is part of a group of chemical messengers called the catecholamines that are thought to induce different clinical states, such as major depressive disorder. Certainly as part of depression, SIGI CAPS, that final S in the acronym stands for sleep or sleep disturbance. And we see what happens to Jerry's girlfriend. Tryptophan, as well as serotonin, are vital with regard to day-night diurnal variation with regard to sleep cycle, right? So whether in the context of a major depressive episode or not, right? So serotonin and sleep, serotonin and major depressive disorder. And oh, by the way, serotonin, that indolamine, that chemical messenger, also for anxiety states, right? So I think the indolamine and, more generally speaking, the catecholamine hypothesis is loosely addressed in last night's episode with regard to identifying the precursor to the neurotransmitter. That is that precursor of tryptophan contained in turkey. The other part of this, which is I think a lot more metaphorical, symbolic, is what Jerry is doing with regard to that tryptophan. And it brings up the topic of drugs such as gamma hydroxybutyrate, or GHB, and or flunitrazepam. I can never pronounce this word. Fluitrazam. I'm sorry, I have to actually take it phonetically. which is a benzodiazepine. Both are considered in the subcategory of date rape drugs, which is exactly what Jerry's doing here, right? So even though he's using turkey and wine, the fact is that we're looking at date rape drugs, including GHB. A couple of quick things about GHB, which often comes up on exams. Number one, GHB is also naturally occurring. It's a precursor itself to a couple of neurotransmitters, including GABA as well as glutamate. It does have medicinal use. It is actually used medically for sleep, of all things, again, sleep-wake disorders, specifically narcolepsy. But it's also used recreationally too, where individuals have, at low doses, a sense of empathy, connectedness, certainly altered mental status, and of course, higher doses, we see respiratory suppression and then dissociative amnesia as well, hence the date rape drug. Interestingly, what I found is that the street name for, or one of the street names other than Liquid X or Liquid E, another street name for GHB happens to be lollipops. And I thought that was interesting because there's an allusion to, in last night's episode, to gumballs. And if Larry David had just switched that to lollipops, it would have actually been near perfect with regard to the street slang for GHB. So date rape drugs, I just wanted to make sure I covered. We're going to talk about more aspects of drug use when we kind of flip this and continue this discussion, albeit through the narrative of Peter Pan at noon. One last point with regard to just making that segue. We have the Seidler, and we have Elaine's attempt to unseidle the Seidler by giving him Tic Tacs. And I just couldn't help but think that as the Seidler is provided this, it's very similar to the clock having been swallowed by the crocodile, the croc, in Peter Pan, and that every time Captain Hook heard the ticking, he knew that that croc was about to sidle him. So the Tic Tacs, I think, are a metaphor, an allusion to Disney's Peter Pan, and we're going to actually discuss that specific film at noon today. And we're going to get into more discussion about drug and drug abuse through the narrative, through the Disney classic of Peter Pan. Before we end, any more questions from anyone in attendance?
Dr. Tobia, so it sounds like the M3s have a at 12:45 is when your PCM is. It starts at 1, and then at 12:15 you guys have an optional like wellness thing. I just wanted to make sure that you were aware.
Yep, we're gonna have our case discussion from 12 to 1. And because of the other optional didactic, the noon discussion of Peter Pan will also be optional. Yep. All right. Thank you very much. That's it for the Merv Griffin show today, and we'll see everybody next week. I will tweet next week's episode with regard to the situational comedy Seinfeld over the weekend. Thank you.
Dr. Tobia?
Yeah.
There's some questions in the chat.